Hello friends, welcome back to my channel. So today's topic is knee joint. It is a very important question, okay? So let's get started. Definition. The knee joint is largest and most complicated joint in the body. It is major weight bearing joint in the body. Type: condylar synovial joint. Two condylar joints between condylar of femur and tibia. Saddle joint between femur and patella, and it's a hinge joint. Articulating surface. Articulating surface of medial and lateral condylar of femur are occupy anterior, inferior and posterior surface of this condyles. Trochlear surface of femur, located on the lower end of anterior aspect of femur. Articular surface of the patella, on the posterior aspect of patella and articulates with the trochlear surface of femur. Articular surface of medial and lateral condyles of tibia on the upper surface of this condyles. Stability of knee joint. I am a bit fast and just make it to a bit slow and then you can see. Stability of knee joint. Factors maintaining the stability of knee joint. Strength and actions of the surrounding muscles and tendon. Medial and lateral collateral ligaments maintain side-to-side stability. Cruciate ligament maintains anterior-posterior stability. Iliotibial tract helps stabilizing a partially flexed knee. Ligaments of knee joint. See, it's a 5 marks question and very important. Before this, I have uploaded a video on hip joint, and that ligaments is also important question. Actually, this whole knee joint and hip joint is an important question. From both 1-1 questions will definitely come. Important ligaments of knee joint. Capsular ligament, joint capsule, also known as ligamentum patella, tibialis, tibial and fibular collateral ligament, anterior and posterior cruciate ligament, medial and lateral menisci. Other secondary ligaments are oblique popliteal ligament, arcuate popliteal ligament, transverse ligament, coronary ligament. So this is a diagram of ligaments. Here let's explain. Capsular ligament, which is also known as joint capsule, medially attached to medial meniscus, strengthened by tibial collateral ligament. Laterally, no attachment to lateral meniscus. Posteriorly, strengthened by oblique popliteal ligament. Anteriorly, blends with ligamentum patella. This is a very difficult question. Actually, so many contents are there. I also referred YouTube. You can also refer my notes, or you can look for other also, but I guess this will be helpful. So anteriorly blends with ligamentum patella. Patellar ligament continues of quadriceps femoris tendon inferior to patella. Patellar tendon reflex or knee jerk reflex, tapping patellar tendon or ligament with a reflex hammer to elicit extension at knee joint. Both afferent and efferent limbs of reflex are in femoral nerve. Tibial and fibular collateral ligament. Tibial, medial collateral ligament. Superior attachment, medial femoral epicondyle. Inferior attachment, superficial part, tibial condyle and tibial shaft. Deep part, medial tibial condyle, medial meniscus, and blends with capsule. It resists excessive abduction of leg at knee, also known as valgus stress. Lateral fibular collateral ligament. Attachment. Lateral, superiorly it is lateral condyle of femur, inferiorly it is lateral surface of head of fibula. Then we have second is arcuate ligament, other secondary ligament. Anterior band, lateral condyle of femur, posterior band, medial condyle of tibia, ends stelloid process of fibula. Medial and lateral menisci. Medial, it is C-shaped, firm attachment to tibial collateral ligament, frequently damaged. Lateral menisci, it is oval shaped but little bit of gap, almost circular. Not fused to lateral collateral ligament. Other secondary ligaments are oblique popliteal ligament, expansion of inserted fibers of semimembranosus, extends supralaterally, blends with posterior part of capsule. Anterior and posterior cruciate ligament, main ligament, attachment anterior, weak and damaged frequently. Medial aspect of superior surface of tibia, lateral aspect of inferior surface of femur, posterior stronger. Anterior is weak and damaged frequently, posterior is stronger. Lateral aspect of superior surface of tibia, medial aspect of inferior surface of femur. Transverse ligament, present in 40% of individuals, extends from the medial meniscus to anterior margin of lateral meniscus. Coronary ligament, these are parts of the fibrous capsule that provides attachment to the menisci. Bursa around knee joint are, there are 12 bursas around knee joint. 4 in anterior bursa, 3 lateral bursa, 3 medial bursa and 2 posterior bursa. First, anterior bursa. Subcutaneous prepatellar bursa. Bursa of housemaid's knee is also known as, and this is an important MCQ question. Subcutaneous infrapatellar bursa. Deep infrapatellar bursa, suprapatellar bursa. Lateral bursa. Fibular bursa, bursa under popliteus, bursa under biceps tendon. Medial bursa, bursa anserine, bursa of semimembranosus, bursa between tendon of semimembranosus and medial condyle of tibia. Posterior bursa, lateral gastrocnemius bursa, medial gastrocnemius bursa, also known as Brody's bursa. Relations of the knee joint. Anteriorly, tendon of quadriceps femoris, patella, ligamentum patella, patellar plexus of nerves, prepatellar synovial bursa. Anterior-medially, medial patellar retinaculum. Anterior-laterally, lateral patellar retinaculum and iliotibial tract. Posteriorly, popliteal vessels, tibial nerve and oblique popliteal ligament. Posterior laterally, in the upper part, tendon of biceps femoris and common peroneal nerve. In the lower part, lateral head of gastrocnemius and plantaris. Posterior medially, in upper part, sartorius, gracilis, semimembranosus and semitendinosus. In lower part, medial head of gastrocnemius and popliteus. So this is the diagram of the relations, and blood supply. Knee joint is richly supplied by the blood through the arterial anastomosis around the knee, formed by 5 genicular branches of popliteal artery, descending genicular branch of femoral artery, descending branch of lateral circumflex femoral artery, 2 recurrent branches of the anterior tibial artery, circumflex fibular branch of posterior tibial artery. Nerve supply. Femoral nerve, tibial and common peroneal nerve, obturator nerve. Movements. Flexion and extension, medial and lateral rotation. Clinical anatomy. Osteoarthritis. The patient has swollen, painful joint with difficulty in walking and going up and down the stairs. Total knee replacement. TKR. Injuries to cruciate ligament. Clinical correlation, locking and unlocking of the knee. This is an important correlation. It can come in 5 marks also. Locking of the knee. When the foot is on the ground, the locking is defined as the medial rotation of femur on the tibia or lateral rotation of tibia on femur during the terminal phase of extension of knee. When knee is locked, it becomes absolutely rigid and all the ligaments of the joint are taut. This is known as screw home mechanism. Unlocking of the knee. When the foot is on the ground, the unlocking is defined as the lateral rotation of the femur on the tibia and medial rotation of tibia on femur. During initial phase of flexion, the unlocking is brought about by the popliteus muscle. Thank you. So this was all about knee joint, and if you want the notes, message me on my Instagram and I'll send you the PDF there. And if you have any doubt, comment it in the comment section and I'll reply. Thank you guys. Bye bye. Take care.